Hi guys, how you doing? Today, let's go completely back to basics and let's talk about what dental implant treatment is. And to keep it simple, we're going to talk about just replacing a single tooth with dental implants. Now, I know some of the subscribers on this channel are pretty well educated on dental implant treatments, but we're getting 2,000 to 3,000 new subscribers every month, and there are a whole bunch of people for whom dental implant treatment is a completely new thing. So maybe you've been told by your dentist that you've got this bad tooth and maybe consider dental implants, and this is the first time you're hearing about this and you wanted to do a bit of research. This video is really to help you at the earliest stages of understanding what dental implant treatment is. Now, in a nutshell, dental implant treatment is just one way to replace a missing tooth. The other ways are a removable denture or maybe a bridge. Now, your dentist will talk to you about the advantages and disadvantages of each of these three treatments, taking into account your individual circumstances, because dental implants are not the best treatment for every single person who has a missing tooth. Now, it is thought that replacing a tooth with a dental implant is the closest we can get to replacing a natural tooth. There are a bunch of different differences. I've made videos in the past about this, and dental implant treatment is by no means a perfect solution. Now let's talk about the advantages quickly, right? Dental implants are strong. Once the implant is in, it's integrated, it is probably stronger than a natural tooth. It will not move at all. They look pretty realistic, and if you're having a tooth at the back, it will look pretty much just like a dental implant. At the front, it's a little bit more complex, but I'll come on to that later. They're a pretty long-lasting treatment. We expect dental implants to last a long time. Now, we're very vague about how long they're going to last because it's different in every situation. A lot depends on your medical condition, your medical history. A lot depends on how well you're keeping the health of your gums and your genetics. Are you predisposed to gum disease? All of these things will influence how long these treatments are going to last. Now, let's break a dental implant up into its three kind of components, and I'll walk you through the different processes that we have to place dental implants. So when a dentist is talking about dental implants, the actual bit that they're specifically talking about is the bit that goes into the bone. Yes, it looks a bit like a screw, and yes, they're typically screwed into the bone, but we don't like to call them screws. So the dental implant itself, as a patient, you would never really see this. So the hole is made in the bone where the implant's going to go, and then the implant is placed or screwed into the bone. And then we need to let healing happen. So healing of bone typically takes 3 to 4 months. In the lower jaw, the bone is more dense. It's a little bit quicker to get an implant fully integrated in the lower jaw. In the top jaw, especially towards the back, we typically leave it a little bit longer because the bone isn't quite as dense, and it's just better to leave it a little bit longer. Make sure you've got that good integration between bone and dental implant. Now, traditionally, what would go on top of an implant is something called an abutment. And this is essentially a little connection which connects the tooth part, which we call the crown, to the implant part, which we've just placed in the bone. And what used to be the case in the vast majority of implants is you have this abutment which is screwed into position, and then the visible part of the tooth is then glued onto the abutment in the same way that a crown is placed on a natural tooth. Now, these days we try and do things a little bit more different to this. We will usually combine the abutment and the crown into one unit, and the whole thing is then screwed into the implant. This has a major advantage in that in the future, if there's ever an issue, if there's ever gum irritation or a problem with the crown, or the implant just doesn't feel right, it's really easy to just unscrew this whole crown and abutment, this whole unit. It comes out and we can investigate the implant at a much deeper level. Now, having a system like this also has slight disadvantages, but I think they're a bit more advanced, a bit out of the scope of this video. But in general, I would say in my clinic, about 99% of implants are screw retained because the advantages outweigh the disadvantages of this kind of system. Now, there's a number of different ways that you can have dental implant treatment, and it depends on your individual situation. Let's say you've got a missing tooth there already. Then it's quite simple. We'll take a CT scan, we'll look at the thickness of the bone, the height of the available bone, how far nerves and sinuses, all this kind of stuff is, and choose the appropriate sized implant. Then you can have a treatment to basically put the implant in. We normally book about 2 hours, of which about half an hour is actual surgical time. And the whole area is numbed, a little cut is made, a hole's made for the implant goes in, and a few stitches to close up. Then after a few months, once we know the implant is integrated, we can then take an impression, kind of similar to if you've had an impression for a crown or a veneer, over the top, and we can have the tooth part made and then screwed in. Now, sometimes people are in a situation where you have a tooth which is in a really bad condition. Maybe there's an infection underneath it, maybe it's broken in a certain way, and there's no way that we can save this tooth, and it might be right at the front of the mouth. So there are techniques available where you can have the tooth removed, you can have an implant placed on the same day. Sometimes we do bone grafting, tissue grafting at the same visit as well. And then you would leave this practice with a temporary tooth in position. This is really neat because from an aesthetic point of view at the front, not many people are willing to walk around without a front tooth. Then after the same healing time of 3 to 4 months, you can then have the final tooth made, and that can match the color with your natural tooth really, really well. Now, implants at the front of the mouth are typically difficult, not in terms of getting the aesthetics right, not because the tooth is actually really easy to match in terms of color shade, but it's the gum aesthetics, okay? Getting the gum lines symmetrical on implants at the front of the mouth is really, really tricky. And this is where it pays to see somebody who's more experienced in dental implant treatment at the front of the mouth, because it's not just a case of having a dental implant. When you have a tooth removed, the bone changes shape. You need to compensate for this change in shape. It may mean that you need some kind of bone grafting or connective tissue grafting in order to get the right aesthetics at the front of the mouth. Now, for some people, this is important. For some people, it's not important. So again, it depends on your individual situation as to what the best way forward is. Now, at the beginning of this video, I gave you a whole bunch of advantages of dental implant treatment. But there are some disadvantages that we need to be aware of, and I've kind of alluded to one already, and that is the treatment time. It takes a long time to do all of this properly. Yes, you can Google search, you'll find teeth in a day, immediate dental implants, but you almost never get the finished result on that day. You'll get temporary teeth on the initial day. And again, it's situation dependent. So it may be that treatment is a possibility for 80% of people, but you could be unlucky and that might not be an option in your case. Or it might just be safer to do it in the more traditional way, which is take the tooth out, let it heal, implant goes in after 3 months, then the tooth goes on top after 3 to 4 months. Okay, so just be aware. And again, if you go to a more experienced implant surgeon, they will give you more options. What we call the immediate implant, which is when you have a tooth taken out and implant placed straight away, is a much more technically advanced treatment than having an implant placed in a site where the tooth has been missing for 3 to 4 months already. So if you go to a beginner, I'm sure you'll get a decent result. But if you go to someone much more experienced in this kind of stuff, typically you might have a couple of different options in terms of the way that the treatment is carried out. Now, there's different terminologies which dentists use, and to be honest, before I got into implants, even as a dentist, I found this stuff confusing. So I'm going to try and break it down. We've got immediate placement and we've got immediate loading of the implant. These are two different things. And immediate placement is what I've just described, where you have a bad tooth removed, you then have the implant placed on the same day. Immediate loading depends on whether you get the tooth on the implant on the same day, a temporary tooth, or you wait a period of time and then have the tooth placed after 3 to 4 months. If we're doing an immediate placement and immediate loading, you're almost never going to get that final tooth placed in that visit. You would have a temporary tooth placed that would shape the gums. That would also give you something there for aesthetic reasons, but it's decoration only. You can't chew on it. If you do chew on it, you will typically break the temporary or lose the implant, and we're back to square one. And this has happened to me a few times. It's incredibly frustrating for me and my patient. I mean, we don't charge anything if it happens to our patients, but I think we should. So typically there's less risk if you have the tooth placed on at a later date. Again, it's very situation dependent, and a lot depends on your individual bone pattern and your individual situation. Now, I spoke about aesthetics of a front tooth implant, and this is really important. This is probably the hardest thing in implant dentistry. Placing the implant is relatively easy compared to getting that ideal end aesthetics, because when we have a tooth out, the bone shrinks. This is normal. Everybody knows that this is going to happen to some degree or another. And we need to compensate for this. So if you have a tooth which is going at the front of your mouth and you want to get the ideal aesthetic outcome at the end of treatment, then it's worth doing your research and finding a clinician who can do that for you, because any old dentist can put an implant in. That's easy. But we need to either do a bone graft procedure or a connective tissue graft procedure. And these are additional procedures. They're going to have additional time, additional cost to compensate for the loss of bone that you're going to get when the tooth is removed. Then it's usually a case that you need to have your temporaries shaped and reshaped a few times to mold the gum into getting that aesthetic result, and then you have the final tooth made. And again, this is the easy bit. Okay, it's that bit in the middle about getting the gum to look right. That's hard and takes experience and time, whereas the actual putting the implant in and having the tooth done on top are typically easier. Now, I say that putting the implant in is easy, but there's a number of people who have contacted us saying, hey, look, I've had my implant placed abroad. Can you put the tooth on top? And when we look at it, the implant placement is totally wrong, and it just cannot get a good result on that implant. So putting the implant in is important. There's a bit of flexibility, but if it's totally in the wrong position, then there's no way, even with connective tissue grafts, bone grafts, that you're going to get that ideal aesthetic result again. Now, let's talk about the pain. Okay, typically with dental implant treatment, there shouldn't be a lot of pain afterwards. There should definitely not be any pain during the procedure if your dentist knows how to numb up properly. I mean, once we give our injections to numb up, we wait 10 minutes because that's how long it takes for the anesthetic to go deep into the bones. Then afterwards, depending on the procedure you had, will dictate how uncomfortable it is. If you had a simple implant placement, which is literally little cut, hole, implant in and closed up, you're hardly going to feel it the next day. Whereas if you had bone grafting, tissue grafting, that kind of stuff, as well as the implant, then you're going to swell up. You're definitely going to swell up for a week or so afterwards. But the pain is usually less than what you're thinking or what it looks like in the mirror. It looks worse than it actually feels. But saying this, some people do experience a lot of pain afterwards as well. I'd say the vast majority, it's less than what they expected, but some people will find it uncomfortable, and you'll have to manage it just with usually over-the-counter painkillers. You don't need anything stronger for this kind of treatment. So I hope you found this video useful. I hope it gives you a little bit more insight into dental implant treatment if you are just exploring this as a treatment option. For the vast majority of people, this is a fantastic treatment, and nobody regrets having it done. It is expensive. It will take time. There are complications and risks that you need to know about, but this is true with pretty much any dental work. So until next time, guys, if you found it useful, give it a thumbs up, consider subscribing, and I will see you soon. Take care.